Hi there, my name is Richard McMunn from the interview training company passmyinterview.com, and in this tutorial I am going to teach you how to answer nurse behavioural interview questions. So if you have a nursing interview coming up for any healthcare organisation whatsoever, please make sure you stay tuned and watch this presentation fully from beginning to end, because this is what I'm going to cover. I'm going to give you a list of common nurse behavioural interview questions that I strongly recommend you prepare for. I will also give you suggested answers to difficult and challenging nursing interview questions to help you succeed. I will give you some great tips on how to be the standout candidate during your nurse interview. And finally, I will tell you about further resources you can get access to help you succeed. So there's 4 reasons why you should stay tuned. And just very quickly, before I start the training presentation, a very warm welcome to this nurse behavioural interview training tutorial. My name is Richard McMunn. That is me there in the centre of the screen. I am a former fire officer of 17 years, and since then I've been helping people like you to pass their job interviews, and I always do that by giving you top scoring answers you can't find anywhere else. On that basis, please make sure you subscribe to the channel so you don't miss out on any of the training tutorials I am uploading. And please do make sure you give the video a like, because that tells me you enjoy the content, and I will then create more for you. Thank you very much. Okay, let's get started. So the first interview question, the first nursing behavioural interview question that I want you to prepare for is: describe a situation when you had to work with a difficult member of a healthcare team. What was the situation and how did you deal with it? So a behavioural interview question is one where you have to respond with a specific situation you have previously been in. And it shows then that you have the skills and qualities to perform the role of a nurse to a competent and highly effective manner. So here is my suggested answer to this first nurse behavioural interview question. I was assigned to work on a busy ward at my local hospital, and one of the medical staff was clearly quite stressed with the workload. I could detect as the shift progressed that her stress levels were increasing because she started to make minor mistakes. I decided to speak to her to see if she was okay. I was initially met with a frosty and defensive response, but I didn't let this deter me from persevering. I suggested we took a short break together, and during that break I started to talk to her about the challenges she was under and how she was feeling. It was clear that she had personal problems at home, but nobody to talk to about them. Now, over the next few weeks, we constantly chatted when the opportunity presented itself, and our talks clearly had a positive impact on her well-being and mindset. I encouraged her to seek professional advice, which I am happy to say she agreed to. We built up a good friendship on the ward, and I was pleased I had helped her to reduce her stress levels as her performance at work quickly got back to where it should have been. So that kind of situation shows that when dealing with somebody who is being difficult, whether they intend to or not, you are being mature and professional about the situation, and you are trying to resolve it for the wider benefit of the healthcare team and organisation. So that is a situation that has a positive outcome due to your intervention. And that's the important way to respond to that nurse behavioural interview question. The next one I would like to work through with you is: describe a time when a patient's family were dissatisfied with the care or treatment you provided. How did you respond to the criticism? So here is my suggested answer. I was discussing a treatment plan with the family of an elderly patient who was being discharged from hospital when the daughter told me she felt the plan was inadequate for her father's needs. I listened to her concerns carefully before explaining the reasons for the choice of treatment and the benefits it would have for him. I also explained that the treatment was based on my examination of her father, and I reassured her that the treatment plan would be reviewed periodically with follow-up consultations. I also explained that, in my experience, this was the safest and most appropriate treatment plan for him based on his condition. I reassured her that the treatment would be changed if my assessment deemed the need to do so in the future. And whilst communicating with her, I was transparent, and I also used easy to follow medical terms that she would understand. Now that answer is strong because you are listening to the person's concerns. You are then going through the treatment plan and explaining why you have decided to choose that particular plan. You are saying that it will be reviewed periodically, and also you are being transparent, which is very important as a nurse within medical scenarios. And you are also using easy to follow medical terms, so you have strong communication skills, and that is also important. Don't forget, if you are enjoying these, please make sure you hit the like button and subscribe to the channel. Thank you very much. The next question, the next nursing behavioural interview question is: describe a situation when you were given vague or inaccurate information within a medical situation. Here's my suggested answer for you. At the end of a busy shift at my current hospital, a locum nurse was handing over to me. The information she was giving seemed vague and unclear. She also appeared to be in a rush. I asked her to stop speaking and to go back over the medical notes in a slower, more concise manner, which would allow me to follow up with any clarifying questions. She appeared a little bit put out by my request, but I told her it was very important that we conducted a thorough handover to ensure continuity and first-class patient care. She started talking through each area with me in greater detail this time, and I needed to ask for clarity on a couple of different points relating to how the patient had been responding to his treatment. At the end of the handover, the information I had received was now much clearer, and the locum nurse understood how important it was to ensure all handovers in the future were concise and accurate. So this shows that you understand the importance of a handover, and that you do get the information that you need, and you are not afraid to say so when you feel something is inaccurate or missing. And that answer is particularly good because at the end you are educating the locum nurse on the importance of making sure that handovers are done thoroughly. Now, don't go anywhere because I still have more nurse behavioural interview questions to work through with you. But when you're ready, if you want to click that link, you can download my full set of 24 nurse interview questions and brilliant answers. The next question, though, that I would like to work through with you is: describe a time when the medical department you were working in was going through significant change. So this is a common nurse behavioural interview question because change has to happen on a periodic basis within any healthcare organisation, whether it's the National Health Service or, the health service within the country that you are based in. Change is very important because the needs of patients change all the time, and medical treatment and advances change all of the time as well. So as a nurse, you have to be open to change. Here's my suggested answer. I'm a strong believer that change brings about good things, and providing it is embraced positively, improvements will often follow. Recently, the healthcare organisation I was working for needed to reconfigure, which meant many of us within the healthcare team would be moved to different departments. Now, the change was needed to balance out the skill set and experience across the organisation. Quite a few people within the team objected to the changes, but personally, I could see the benefit of them. I explained to my colleagues the changes would allow us to get to work with other people from across the organisation, and it would be a good opportunity for us all to try new departments and different medical working practices. Eventually, everyone within the team could see the benefits of the changes, and most people were quite excited about them. Change within healthcare organisations is vital. As the healthcare needs of patients change and medical advancements improve, we as nurses and healthcare workers need to also adapt. That response shows that you are positive about change, you understand why it is important, you are also willing to encourage others to view change as a positive thing. The next question. Explain a situation when you provided medical educational advice. There have been many occasions where I provided medical educational advice to patients, and it is something I try to embed in my daily work as a nurse because we have a duty to educate people. Recently, a young man was admitted to the hospital due to pains he was experiencing in his liver. Upon inspection and investigation, it became apparent that his alcohol consumption was well over the recommended daily amount, and concerning habits were developing that could lead to prolonged alcohol abuse or alcoholism. Throughout my time treating him, I used the opportunity to explain how irresponsible alcohol use could cause significant and potentially irreparable damage to his liver. And whilst I did not use shock tactics, I made it quite clear that visits to the hospital would be a recurring theme unless he changed his lifestyle. I then went on to provide details of support services that were available in the local area, and I encouraged his mother, who was with him at the hospital, to get involved with ongoing help and support. Fortunately, I never saw the young man again at the hospital, and I was hopeful that my early educational input would have had a positive and influential impact on his mindset and habits. As nurses and healthcare professionals, we need to continue to provide educational advice, as this will have a positive impact in reducing pressure on healthcare services as a population continues to grow and people live longer. So that's a good example of where perhaps you were treating somebody, you recognized there was an issue that could get much, much worse. So you then offered educational advice and encouraged somebody who was with him to be a supportive person in that process. You've talked about supporting services that were available, and you also show that you recognize how important it is to provide medical educational advice because the pressure the healthcare services are under. So the next thing is, please do click that link in the top right hand corner of the video and go through to my page at passmyinterview.com, where you can download my full set of 24 great answers to tough nurse interview questions. I hope you've enjoyed that. Thank you very much for watching, and I wish you all the best for passing your nursing interview. Have a brilliant day.